So what you're reading is a real life scenario. But let me ask you, so now that you're looking at it, you're trying to assess, maybe in your mind conceptualizing an approach or thinking about a treatment plan or other kinds of interventions, what stands out to you in this that you would want to focus on? And if you want to say anything about why or how you would do it, that's also good. And remember, we're videoing, and if you could say it in your louder outside voice, that would be good. So, who wants to start? Yes? Okay, so nice strength-based approach. I think that's a great place to start. She said he did well with stabilization. So and even more specifically, he has a family environment setting that he did well in, and he does have some evidences of good performance and an ability to connect to people in positive ways. That is such a protective factor when we're talking about folks who we're working with who may potentially get involved in bad behavior. So that's a good place. What else? What else do you see?
Can I just comment that?
Okay.
Quickly, just that in some ways, as good as that looks and as good as that sounds, and as much as I would want that to be the case, that was one of my biggest concerns, because I was concerned that he in fact was had created maybe coercive, but maybe not, but just secret relationships with the other children in the foster placement, after foster placement, that were sexual in nature, and that helped him feel calmer, and that's why he wasn't making at home, and that might come out later.
Okay, I can understand where you're coming from, and I want to say not at all to kind of downplay what you're saying, but I get concerned about that kind of conceptualization, because without any evidence that he's engaging in such negative behaviors, I'd be really concerned about starting in that direction. We don't want to get in a situation where we assume, and this is the catch-22 that a lot of our folks deal with. When they're doing badly, see, I told you, and when they're doing well, it's because people haven't caught them, or because they're being sneakier. So I think that underlying what was said about stabilization that can speak to some of what you're saying is, that doesn't mean that I don't want to put safety measures in place with his sister. That doesn't mean that because he has a 10-year-old friend that I can just ignore that. It doesn't mean that I'm going to leave him alone unsupervised with minors, okay, because I do want to be careful about that. But I also don't want to assume that because he's had a good placement, it's because he's doing things in a more secretive way. I can tell you, having worked with this, the family environment that he had, any kid would have probably had behavioral issues. There was a lot of difficulty in that home. And people were trying to do the best they could, but they were having a lot of difficulties. I think that it was probably more due to having some consistency that helped him kind of level his behavior, more so than him being trickier. Because as time goes on with this case, as I started to explore it, sexual misbehavior was actually not one of his bigger issues. This is somebody who it seemed as if was going to be a homosexual male. I mean, he was starting to come into terms with that in a household that wasn't very supportive of him. And so the only sexual issue we really wanted to work with him was just to help him be okay with his sexuality and to find ways to express it in healthy ways. And as that was nurtured, he became much less pathological. He just wanted a chance to be sexual and was willing to do it in appropriate ways, but because it was so repressed, it started to come out in ways that got him into trouble and difficulties. What else do you see here? Yes?
Potential complex trauma.
Okay, and say a little bit more about that.
Potential exposure to mom's drug abuse and prostitution, multiple placements, little or no friends, that peer relationships haven't been developed, shoplifting as an indicator, possibly a symptom of all of that.
Very good. And this is kind of almost contrary to what I said with your statement, and that is we don't have evidence of those kinds of things with his mother, but she was prostituting, she was addicted to drugs. It's not a leap to think that there weren't some things there that maybe were a problem. Now, what those extent of those things were could be hard to get to, if we could get to them at all, because she was not a part of the picture. And as a historian, especially when you're telling on a parent, children aren't always going to be the best. So we may not all know. But certainly the environment was there, and we would want to give him a chance to talk about that. The bouncing around and the difficulty making connections is certainly going to be an issue that factors into it. Shoplifting, again, the possibility that's a symptom of, just impulsive behavior, anything from I just wanted that candy bar to I'm looking for help or attention. The other piece, though, I want to keep in the back of my mind is one of the higher risk recidivism factors is what we call criminal diversity. So if you have a kid and the only time he gets into trouble is when he inappropriately touches somebody, I mean, that's an issue we want to work with, but it's generally not seen as a higher risk as a kid who's in all kinds of trouble, just a lot of delinquent behavior, and sex is just a part of it. And that carries over into adulthood. Some of the factors that can score you higher on, say, for example, psychopathy measure is how diverse is your criminal behavior? How often are you getting involved in other things? So it could be something minor, or it could be something we want to pay closer attention to, keep that in the back of our head. But there's certainly a lot of trauma going on there. Others? Your hand was up first, and I'll come back to you. Yeah.
Just lots of attachment issues, different foster placements, chaos in the home. When he was younger, it's definitely an attachment. And this might be a leap, but when you have a parent who is involved in trafficking herself or being trafficked, for me, I wonder if it would be important to look if there was any trafficking of the kids.
I think at the very least, kind of going back to what was said there, is the concern here being because she was prostituting, did the children get included in that? And I think that, to assume it happened, maybe that is the leap, but to assume that something sexually inappropriate happened, if we find out, say through investigation, that some of the prostitution was engaged in the home and not just street or motels, certainly, who's being brought into the house, at the very least, what are the kids seeing, and who gets pulled into it, whether it was intentional or while she's nodded off on some heroin jag, maybe one of the people that brought it to the house was perpetrating. So yeah, I don't think it's a leap to be concerned that this is more than just having a mother who's prostitute, and we definitely wanted to look at that. And there was some evidence that, not through necessarily prostitution or marketing of children, but there was some sexual abuse with the daughter outside of James being caught on top of her. So that definitely we want to be concerned about that. And you said attachment. Coming back to what was said, we have a lot of not very good attachment opportunities, but there is some, so we want to nurture some of those and make connections with, say, this art teacher that he has a bond with. And what was you going to say?
Oh, just the simulating intercourse with his sister.
Yeah, that's a scary thing when you see those kinds of things. And so you don't want to, as we said before, over-pathologize exploration. They are fairly close in age. However, this is his sister. This is a vulnerable situation. This is somebody who he's going to have regular access to. And so in this household, we did put in some home management strategies for the safety of the sister. One of the things we see about reporting of sexual offenses with kids, this is always something to keep in mind, especially if you're involved in situations where reconciliation, where the perpetrator is going to be back into the house. And this happens a lot with juveniles. And primarily it's because it's diminished funds makes it very hard to place juvenile offenders. And so we used to always run into situations where a kid would have to go back to the house. And although there isn't a lot of peer-reviewed research around it, colleagues that I've worked with who've done some kind of informal assessment of it says that, of course, we know perpetration of sex offenses is one of the more underreported offenses out there. More frightening is when a fellow by the name of Bill Marshall from Australia did an informal study of children who've been perpetrated against, who did report, and action was taken, and asked them what would be the likelihood you report it if it happened again. Almost all of them said they would. The impact of what happened after they reported it was so detrimental. You know, to adults, it's like, well, justice is served. But to a kid, dad gets taken out of the house, socioeconomic status is negatively affected, people may inadvertently be blaming them for whatever's come of it, all the upheaval that happens. And so in this case, like where she may have said something and James gets taken out of the house, and he's upset and she's crying, next time it happens, is she going to say something? And chances are she may not. And so we have to then be the boundary setters. We have to put in the management strategies. We have to try to help her be in a situation where she may not have to report because nothing happens. Or if she does, that we let her know that this is completely important for James's benefit, that you tell us what's going on. Okay? Nice job with that. I mean, I think you definitely got through the pieces that are important there. Is there anything that we didn't talk about that some of you saw or wanted to put out there? Are we good to go forward? Okay, so as a summary, I guess, of what we talked about, how does somebody get into sex offending? We see a lot of really negative kind of developmental issues around trust and insecure attachment, connecting to other people. Sex offending is a very interpersonal offense. So people who have difficulty in interpersonal connections, leading them into circumstances in which being able to develop healthy sexual relationships becomes reduced because of rejection, loneliness, negative peer associations, and delinquent behavior. This leads to sex that's impersonal, selfish, and adversarial, all of which can, at the very least, be a very bad relationship. And of course, the worst scenarios where sex offending is. And I just want to say, and I promised to stay off the soapbox today. I just moved it over there. I'm not even going to step on the soapbox. But when you look at this as a risk factor, and you look at the way we treat offenders that are being released, you know, in some respects, we actually contribute to a recidivism scenario. And this could be probably said for a lot of offenders. That if you make people really not feel a part of, the ability to develop good interpersonal connections, it's an uphill battle. And if you combine that with somebody who's not had role modeling around that, or has really learned a lot about that, or has learned it in a negative environment, we're not really helping the cause much. So what do we do? What do we target now? We've gone through etiology, so what, you know, how do we deal with it? And first off, you know, we want to look at punishment versus the treatment. Many of you who are in this room are kind of, I'm sure, already aware of the fact that this is a population that does not have a lot of advocates, and certainly you can pretty much do whatever you want to do to the population, and nobody's really going to question it. I talk about that when I do risk assessment workshops. I talk to people about risk assessment. It's imperative that you use good judgment, because if you say this person is dangerous, because I just don't think that they're going to be safe in the community, people will bite, they'll take that. They don't care what they're basing it on. If you say, I think this person really should be given a chance, everybody's scrutinizing every word you've written. How do you come to that conclusion? What's your evidence? So it's very easy to fall in the camp of, let's think of the worst, most conservative, negative thing we can do with folks. And if it don't work, it don't work, but at least we don't have to worry about them walking around us. All intervention strategy studies have shown the same thing, that the tougher, the more punitive, retributive interventions are the least effective. Okay? 3 strikes and truth in sentencing laws have not affected crime rates. And there's evidence that those without them tend to do better than those with them. When we look at imprisonment, and Smith, Coggins, and Gendreau are Canadians who are very good researchers. So this isn't just a kind of a social let's be nice to people kind of research. This is a what's working, what's not working. That in-prison offenders recidivated at higher rates than those with longer sentences also recidivated at higher rates, and that's when we're controlling for the offenses. So, you know, the person who wants to argue it may say, well, naturally, the people who are in prison who have longer sentences are your more serious criminals. So naturally, they're going to repeat offending more naturally. This is controlling for sentences that are being allocated for similar offenses. Because we all know that doing the same crime doesn't mean you're going to do the same time. Especially if you can afford a private lawyer versus having to go through the public defender's office. Nothing against them as attorneys, but when you're handling 300 cases a year versus 50 cases a year, you're going to get treated differently in the courtroom, right? Those who are on probation with intermediate sanctions are actually more likely to be rearrested than those on ordinary probation and parole. Part of that is that they do tend to not do well on supervision, and the other piece is they're more heavily scrutinized, so when they make a mistake, they're more likely to get caught. However, if you keep intermediate sanctions but you add treatment to it, they actually have recidivism rates 10 to 20% lower than the regular release population. Yes?
What do you mean by intermediate sanctions? Is that like having a monitoring bracelet, or what is that?
Actually, monitoring bracelets, you're heading in the right direction. It's more serious. It's more reporting requirements. You have more community requirements. You have much more structured placement in the community. Monitoring, however, is not effective. We find that to be, it doesn't reduce sex offender recidivism. Registration doesn't affect in any positive way recidivism. The expensive GPS monitoring hasn't affected recidivism. Housing stipulations that keep people from living in certain neighborhoods has no positive effect on recidivism. In fact, some of the research that's been done by the Human Rights Watch says that in some cases it aggravates the set of circumstances because vigilante groups get together, or other groups that try to make it more difficult for that person actually makes adjusting to the community more difficult. So in respects to people who've been victimized and people who have very emotional connections to this process, okay, I understand wanting to be extremely cautious about what's going on. But the reality of it is a lot of what's being done is not effective and it's expensive. So why not do the things that are working is really what the argument is. We know that 80% or more of the offenses take place by somebody the victim is familiar with, for example. So a lot of these community supervision strategies oftentimes don't take that into consideration. Okay. If we're going to talk about treatment, one of the things we want to say, or at least look at, is treatment working? And what we have found is that when you're working with a sex offender and you look at recidivism, and it's important for the studies to look at what kind of recidivism it is. Sometimes in the past, recidivism has been anything that got you back into the system. Well, I mean, I can understand some of the rationale there, but if you have somebody who's a sex offender who's getting rearrested because they didn't go to a session with the probation officer, that's significant for them, but it's not so much significant for the sex offender recidivism research. So we're looking at the different kinds of recidivism, and when we look at sexual recidivism, violent recidivism, or any type of recidivism, we can see that those who got treatment had lower rates of recidivism in all three areas. Okay, so there is benefit to getting engaged in a treatment situation. One of the more comprehensive offender research studies that did a meta-analysis of 22,000 treated and untreated adult offenders, a third of them in Europe and outside of North America. The majority of them confirmed benefits of treatment. And it's good that a majority rather than all of them, because if all of them did, we start to question how are you quantifying benefit of treatment. So what this tells us is that treatment can work, but it's not just any treatment. You have to follow certain protocols in order for it to work. In fact, one of the oft-quoted research studies around psychopaths, which is a particular area of interest of mine, I didn't say when I introduced myself, but for 7 years before coming to the school, I supervised the corrective thinking program, which is the program at Sand Ridge for the sexually violent persons who are high in psychopathy. And there was a while there where a research study that said that guys high in psychopathy actually do worse when they're in treatment. And I mean, that got a lot of playtime. And you know, after time, people really started to explore that and found out that not only isn't that true, they can actually benefit or at least perform similar to others with the benefit of treatment. The study that said that they got worse actually looked at a program in which it was, the way it was designed, it was doomed to fail for people high in psychopathy. It was inmate driven, where the guys high in psychopathy tended to be the leaders. They got to dictate who was in treatment and who got thrown out of treatment. They got to dictate a lot of what was going on in the setting. So yeah, they didn't do better. They probably ran the joint, okay? You don't want a group like that, okay? Those of us who are all into self-determination and empowering our clients, there's a time where you have to help self-determining, okay? You have to be the one who says, all right, listen, when you were making your own choices, look what happened. Let's work together on making choices together, okay? We see there's some of the research there about recidivism being less with those that are treated. So I said majority works, some doesn't. What does work? What has been effective as far as interventions go? And again, in the limited time that we have, I'm talking in general terms. There's going to be different needs for different populations. People with developmental disabilities or severe mental illness who have sexual offenses may need additional kinds of work in some areas and not as much in others. Guys high in psychopathy, we have different things that we work on and approaches that are different. So this is the general sex offender population, but understand that if you have a unique set of circumstances, you know, we would want to look at that with a unique lens. The basic piece is that we want to use sound theoretical. There's a lot of good research now about criminological evidence and studies around criminogenic effects. So you want to be aware of that. Using a social learning approach is important. Avoiding retribution. Again, this is a population that does not react well to consequences, not the way that you would think they would react to them. The idea that if you punish somebody and make crime unpalatable, they'll quit doing crime, works for people who don't do crimes. It doesn't necessarily work for folks who commit crimes. Okay, and so we're actually creating an environment that isn't productive when we just focus on that particular area. We want them to be better members of the community. Let's teach them how to be good citizens in the community. Okay? Focus on dynamic risk factors, dynamic being those things that can be changed, and targeted interventions. We want to do evidence-based risk assessment. One of the things that we did in our program is we had people assess who were not part of the actual treatment process. So we had kind of an objective third party look at what was going on. And then try to activate cognitive and behavioral changes so that the person's decision making can actually be better. And this works a lot with a lot of offenders, not just sex offenders. You want to have a high-quality therapist-client relationship. It's important. There's other pieces that are important, but that's important. Responsivity issues, we talk about responsivity, but we ignore a lot of it when we talk about mandated clients. Responsivity is the connection that the person you're working with has to the change process. I mean, do they feel a part of it? Is it matching their learning styles? Do they feel like you're trying to help them, or just the barrier to their freedom? Monitoring the program and treatment integrity with identified areas, okay, in which staff have discretion. So, are people making decisions that tend to be heavily handed all the time? Or are people making decisions that try to be maybe too permissive? Sometimes we get caught up in, I'm going to say it's irresponsible decision making, where we're working with somebody who's in a system that we definitely disagree with, And kind of our way of balancing it is by being overly permissive for somebody. That's also not helpful. Helping people navigate the system, using the best validated treatments, and then of course, people are multimodal. We want to use our interventions in a multimodal way. What doesn't work is deterrence methods. Scared straight, historical failure. We know a lot about the things that didn't work there. Shock incarceration. Non-directive, client-centered psychodynamic approaches. Some people talk about, just treating a person almost in a coddling kind of a way. That doesn't work. Not only is it necessarily the things that the public really kind of frowns on, it really doesn't work. Okay, if you're talking about somebody with difficult frontal limbic connections, trying to appeal to their emotion, and that piece of them is probably putting them in a situation that it's like trying to teach somebody problem solving using math techniques who's never been good in a math class. You got to use techniques and strategies that they're more comfortable with. An intensive non-behavioral group interaction. Some groups where they've had people sit in the middle and they have people kind of challenging them about their belief systems and distortions. That's not going to work. Okay? Again, these are folks who react negatively and not necessarily in productive ways to that kind of treatment. And then treatment mismatch the cases. So this is taking, say for example, taking a juvenile whose offending is based in their social ineptness. In other words, they don't necessarily have deviant sexual interests, but they're, for whatever reason, have difficulty making connections with same-age peers. And with some help and learning better social skills and dating skills, can actually find themselves in healthier, mature relationships. But putting them in a group with all other sex offenders, you end up with what we talk about in forensic and criminal justice treatment as an iatrogenic effect, where people actually get worse or more criminal with being exposed to people who are more sophisticated criminals. And that happens a lot with juveniles who get placed someplace and they may have some behavioral issues, but now they're hanging with guys who are selling drugs, guys who are more involved in maybe more sophisticated criminal behavior, and it's kind of enhancing to them. So we want to be careful, yes?
I don't know what shock incarceration is.
That's, it's a generic term. It's not like they're saying, well, this is the shock incarceration technique. And a lot of it has to do with like kind of segregated, no kinds of treatment intervention, just very punitive kind of incarceration for maybe a shorter period of time, but trying to make it as punitive as possible for the person who's engaged in it. Okay, with things like maybe the more severe end of the boot camp kind of mentality, where people are being woken up at 2 in the morning and those kinds of things. Okay.
Thank you.
Yeah. Yes.
Do you have information about the different types of reasons that people offend? So, like, just have somebody who's very high with psychopathology, somebody who's more about trying to have power control over another person. So, kind of what categories the individual might fit in, and then what the recidivism rates are. Does that make sense?
Yeah. And I understand the question. I understand why you want to know that. I want to say that part of what I'm going to talk about as far as risk factors may give you some information about that. But, and this is Nick's bias as much as it's any kind of research bias, is I avoid taxonomies. I avoid this kind of offender, this kind of offender, this kind of offender, because people just don't operate that way. People operate across dimensions. And there are certain things that, yeah, there are certain categories, if you need a kind of a categorization that deals with, and I didn't talk a lot about it in this because we don't have that kind of time, but I'd be happy to talk to you more about it if you want, where you have folks who are high in the sexual deviance realm. I mean, they get their sexual needs met in ways that are deviant. The more is almost synonymous with being criminally sexual. And then on the other end, you have folks who have very non-deviant sexual preferences, but who, because of difficulty making connections or social ineptness, more or less the younger folks, who engage in, say, sex with somebody who's 12 or 13 because they idolize them, and it ends up becoming a dating relationship. They make bad choices. You also have guys who are just the more psychopathic, who go into a home, they're burglarizing a home, they have no intention of sex offending, but they see there's a female person at the house and figures, what the hell, while I'm here, I might as well. And they get involved in sexual behaviors as part of their overall criminality, but it's not necessarily a deviant sexual preference. They have healthy sexual outlets. And so from a treatment provider, program developer perspective, there are some people I spent much more time around their criminality and less time around their sexual issues. And there's others that we spend a lot of time around their sexual issues. Their criminality, they may be very high functioning in a lot of other areas of their life. And so they don't need as much work with that. And that's just those categories, not taking into consideration developmental disabilities, mental illness, and other kinds of things. So,
and I think a lot of the question is derived from having been working a lot of more of a victim service role. And so it's hard to switch the thinking when you work with victim services. It's hard to switch that.
Well, and I completely understand that. And I think that it's okay to start with a framework that's more taxonomic. In other words, where you have, I mean, the DSM-4 is a taxonomic structure. It gives us categories. But we don't want to get caught up in, if somebody's got depression, then that means that this is how they're depressed. We know that there's differences. And the same can be true with offenders, even with the same offender. I mean, some offenders have child and adult victims. Some offenders have quite aggressive sexual offenses and also have offenses that don't necessarily fit that profile. So it can become difficult when we try to categorize, and that's why I tend to not look at it from that perspective. The things that we do see in the Hansen and Bussier study of '96 is one of the more seminal pieces of research. It's probably the first time we actually started to look at empirically derived risk factors. As a treatment provider at that time, I started to use the impact of this study to help structure my clinical interviews so that I could have a better understanding of identifying risk. But some of the things that they've identified as most correlated with recidivism. And just, step in statistics class, when you're talking about R, this is the difference in recidivism rates between the category of offender and those who aren't fitting in this category of offender. And naturally, one is the perfect correlation. In other words, it's the complete explanation of why they're not the same. But with social research, when you start to have relationships that are 0.3 or higher, that's considered a large relationship. And 0.2 to 0.29 is moderate, and then small, and then what we would consider a tiny relationship, or maybe it's there, but we're not sure that it's a big part of why they're different from one another. What we do see that has the two biggest differences are child sexual preference, measured by the Plethysmograph, or and besides that, any deviant sexual preference. The Plethysmograph is a measure of sexual deviance. It's you start off with like a Bellium gauge. It's like a rubber band. The guy actually puts it on his penis. It's connected to a computer. He watches various stimuli. The lab technician measures the level of tumescence, so the blood flow into the penis, which is a measure of how aroused they are. They can monitor then how the gauge changes. Between each segment, there's a very non-sexual stimuli, maybe a drum beating or just a blank screen, so that they can reduce back to normal levels of arousal. And then they're showed another stimuli, and their level of sexual interest is measured by the blood flow into their penis. So, which is a good indicator of a person's sexual arousal. Yes?
Can you say what that's called again?
It's the Plethysmograph. It's actually, quick history, it was actually developed by, the process was developed by a guy by the name of Freund, who, not Freud, Freund, who, it was actually a tube, and it would go over a guy's penis, and you would measure the displaced air from the tube as he became more aroused. It was actually developed for his country, and I'm blanking on the country, it was, I think either Norway or Switzerland. It was actually developed for the Army to detect homosexuality, to screen them out of the military. And it wasn't necessarily to keep them from going into the military. Guys were saying they were homosexual so they wouldn't have to go to the military. And so they were looking to see if they really were, and they used this as a measure at that time. If you want to, I mean, imagine this. Oh, this was back around World War I, World War II area. And if you, I always used to joke with our tech, I mean, if you want to talk about having to talk about your job at a cocktail party or something, imagine explaining this one. But, so it is a measure, and it's a measure that is fairly accurate. You measure, similar to the polygraph, you also measure respiration and galvanic skin response. So you can see if a person's trying to diminish their own arousal so that they don't come across as having a deviant arousal. So it's fairly accepted across the board as a measure of deviant arousal. The part that we always want to be cautious about is having deviant arousal and engaging in deviant sexual behaviors are not the same thing. You have to make a lot of other decisions to say, for example, it would not be uncommon for any male in here who has normal sexual arousal to show sexual arousal to a fully developed 13-year-old girl, for example. Because the part of your brain that says this is sexually nice is not part of your brain that says, but wait a second, this is a 13-year-old, it's against the law, she's really not at an age where she could give good consent, and this is not the right thing to do. Your body may respond one way, but your decision-making responds another way. And so it's oftentimes in what we consider normal arousal patterns, you'll see somebody that has an adult arousal to either male or female, depending on their sexual preference, and then some arousal to the teen level, and then hopefully when we get to more coercive or aggressive sexual behavior or infants, there's no arousal. Okay? Other things that, oh yes?
Back to the Plethysmograph, is there any measurement for females?
There has been experiments with measures of moisture to try to see arousal, but there really is not one that they consider to be an accurate, valid measure. You know, the whole research, if you want to get into a new area, working with female sex offenders, the assessment and treatment is probably a good area for you to get into, because there is not a lot that's there. And part of that is the culture that we live in. If you look at arrest rates for female sex offenders, they're quite low, like maybe 1 or 2% of the offender population. If you look at data collected from males in therapy later in life, who are either having substance abuse or other kinds of problems, the rates are like 15 to 20%. A lot of guys engage in what would be considered criminal behavior as victims with older females that never see it as a victimization. It never gets reported as a victimization. And so it's, and the approach to the offense is much different. And so it's oftentimes not labeled as a crime by the people involved. So that's a whole different discussion. That's probably why we haven't focused on a measure of that kind of arousal. But that's a great question. Others? You can see some of the other things that probably intuitively you would expect. They didn't complete treatment. This is people who've entered treatment but did not complete it too. That's a higher risk than people who've not gone to treatment at all. Low motivation for treatment, and then of course antisocial personality disorder tends to be a part of a lot of repeat offender situations. Things that did not predict recidivism, that may not be as intuitive: alcohol abuse problems, seriousness of this index offense. A lot of times, folks who know what I do, especially when I worked at Sand Ridge, they would see a brutal rape take place, or on the news, hear about it, and they'd say, well, here comes somebody for you. Sexual homicide, brutal sexual offending, although it has its own issues naturally, does not necessarily mean the person is going to continue to have sex offenses. Okay. The viciousness of it doesn't necessarily make them higher rates for reoffending. Denial of the offense, or whether or not the person had empathy for the victims, is also not predictive. And I'm going to talk to you a little bit about that. And then general psychological problems. There are no mental health conditions that make you more prone. I shouldn't say that. Pedophilia naturally would. But other kinds of Axis 1 disorders that make you more prone to commit a sex crime. When they more updated research study that Hansen and Morton Bourgeon from Canada had, they saw that lack of empathy, again, was not a predictor, actually had a different relationship. So that people who seemed to express more empathy actually were at higher risk in some cases for reoffending. Denial of sex crime still was not a predictor. Minimizing the crime was not a predictor. And lack of treatment motivation kind of had a flip response as well, as far as risk prediction. So the big question is oftentimes, how does lack of empathy or denial of crime not be a factor? I mean, a lot of programs, you can't even get into their treatment program unless you admit your offense. And many programs have some component to it that tries to, what we say, enhance the perpetrator's empathy. So how does that not factor in? There's probably no definitive explanation, but one of the reasons why it can be is people deny for a variety of reasons. Now, if you deny because, say, you want to do this again and you want to be secretive about what you're doing, naturally that kind of denial would likely lead to reoffending. But if you deny because you don't want to be labeled a sex offender, because you're very upset or embarrassed about what you did, you don't want to even own up to it, but you know it was a wrong thing to do, you can benefit from other kinds of treatment interventions that can reduce your recidivism without ever openly admitting to what it was that you did. And in fact, deniers groups kind of sprung from this research, where guys who did not get into conventional treatment for sex offending because they denied things, but still went to other kinds of treatment like anger management, relationship development, and things of that nature, showed reduced rates of recidivism. They actually showed benefit from that treatment. Empathy, on the other side, it's just so difficult to measure in general, and it's very difficult to measure in relations to behavior. I mean, you know yourself. You can turn it off and on whenever it suits you in a lot of cases. So you can be very empathic with somebody, say, that's in your family, and maybe your clients, but if somebody's really done you wrong, it's maybe real hard to be empathic with them. And the same thing with offenders. They have the ability, but they certainly can turn that off when they're talking about or getting ready for a reoffense. So what are some of the other treatment targets? So we want to do sex offender-specific treatment, not just general criminal treatment when we can. And we want to try to do the best we can to keep the person engaged in the treatment process. Well, we can see that dropping out seems to double the rate of recidivism. So setting unrealistic guidelines for the group, or setting it up so that a person who leaves, who doesn't do well, automatically is kicked from treatment as opposed to maybe a remedial treatment group, is something you may want to think about. Treatments of juveniles, this is the trend, but not necessarily significant finding, tends to be more effective. I think part of that is just a lot of the guys who are in treatment as juveniles grow out of their offending even without the treatment, but certainly learning certain skills helps in that environment. People who are in treatment voluntarily tended to do better, and outpatient treatment is certainly more effective in some cases than institutional treatment. Say, for example, a person who's molesting children who's locked in a place where children aren't allowed. Working that person in a treatment environment is going to be different than somebody who's facing those challenges each day while they're in treatment. And I don't want to go through the whole list, but if you're dealing with a treatment program that works with sex offenders, or if you have a treatment program that works with sex offenders, they should have some component of these kinds of issues there as it relates to the person's offense. Okay? Yes.
So the other day, or last week, we had Daryl who runs abuser treatment groups. Some of what you're saying about treatment with sex offenders, which also a higher rate of bail, is really in contrast with what they're doing with abuser treatment around acknowledging behaviors and identifying problematic thinking.
Okay.
Can you say something about that?
Well, I mean, it's very different populations. I think that folks, one of the things people oftentimes have a misnomer about sex offending is that it has little to do with sex. It's all about control. You know, that's a kind of a lay person or a peripheral observer opinion of that. I think sex offending is about sex. All the risk factors that get the highest scores have to do with sexual interests that are deviant of some nature. That is as a kind of a primary variable. Certainly there are other factors, interpersonal factors that play in about whether or not this person will be aggressive, violent, or continue to be criminal. But when we're talking about sex offending and interventions with sex offenders, these are the issues that are primarily the ones that we want to focus on because they're the ones that seem to contribute the most to sexual offending. Now, if I were doing a presentation on, say, my CT program where I have high levels of more violent guys, less sexual deviance, but more kind of criminal general behavior, maybe that would look a lot more like the stuff that you were getting from Daryl. But a person who commits a sexual crime is different than a person who's engaging in domestic violence. Now, a person who's committing in their domestic violence does sexual things as part of that, that's one thing. But the component of what makes a person a sex offender is not the same as a person who's, you know, I don't know what, maybe we could ask Daryl what the percentage of domestic violence cases involve sexual perpetration. But there's very different motivating factors, different precursors, different dynamic risk factors involved. So it doesn't surprise me that there aren't differences.